At Talteam Inc., we understand that technical excellence drives mission success. Founded in 2011, Talteam is an Inc. 5000 award-winning company and a trusted federal contractor. We deliver innovative technology solutions to agencies and enterprises that demand precision, security, and scalability. Our core expertise: data, artificial intelligence, and machine learning. These are the technologies transforming how agencies like CMS deliver services and make decisions. We've earned the trust of federal partners, including the FDIC, the Consumer Financial Protection Bureau, the National Library of Medicine at NIH, and the Frederick National Lab for Cancer Research. On the commercial side, we support large enterprises like Blue Cross Blue Shield Association, CareFirst, and even Disney. With 36% year-over-year growth, Talteam is a mature, process-driven organization. We are CMMI Level 3 certified with a DCAA compliant accounting system, ensuring transparency and accountability in every engagement. Our security posture includes ISO 27001:2013 certification. We're also accessible through GSA Mass and 8A Star 3 contract vehicles, making procurement seamless. At Talteam, we don't just deliver solutions, we partner with agencies to build resilient data-driven systems that support public health and service delivery. Let's explore how we can support CMS's mission securely, intelligently, and collaboratively. Let me turn it over to Sheetal, who will describe our solution at the National Library of Medicine and how it supports CMS's mission.
Hi, I'm Sheetal Mirchandani, Vice President of Customer Success at Talteam, and we're proud to align with CMS's 2026 vision to make America healthy again. We're driving innovation through modern technologies to build a truly connected digital health ecosystem. Together, we're not just meeting the moment, but we're shaping the future of government healthcare. To deliver high-quality, compliant care across Medicare, Medicaid, and other federal programs, CMS relies on standardized clinical terminology. This is where the Value Set Authority Center, or VSAC, comes in. Hosted by the National Library of Medicine, VSAC is the official source of truth for validated and version-controlled clinical value sets used in CMS's electronic clinical quality measures, eCQMs. It supports major terminologies like ICD-10, SNOMED CT, CPT, and LOINC, enabling semantic interoperability and especially FHIR-based data exchange, accommodating both intentional and extensional value set searches. Extensional searching lists codes explicitly, while intentional value set searches codes based on rules. Creating and updating large extensional value sets was slow and resource heavy, especially when manually curating thousands of clinical codes. To alleviate it, VSAC transitioned to intentional value sets, which uses logical rules instead of static lists, making the process smarter and more scalable. Let's take an example. An extensional value set that represents diabetes mellitus has approximately 800 codes. The same value set can be represented in a very logical and concise manner using a simple statement such as all concepts that are descendants of diabetes mellitus disorder. I will now turn it over to my colleague Krishna Kanukanti to talk about the technologies that make this magic happen.
Thank you, Sheetal. I'm Krishna Kanukanti, Solutions Architect at Talteam Inc. Let me start with the challenge.
When VSAC first launched, creating and expanding large value sets such as diabetes mellitus could take minutes per request. For value set and measure authors,
That's not just frustrating, but it slows down CMS' ability to publish accurate quality measures that impact millions of patients. Recognizing this as a critical architectural challenge, Talteam conducted a comprehensive analysis to identify performance bottlenecks. Within 2 months, we developed a proof of concept that prioritized speed and scalability. By leveraging Redis and Elasticsearch, we enabled near instantaneous responses even when processing hundreds of thousands of codes. This marked a pivotal shift. VSAC evolved from a slow, resource-intensive system into a high-performance, scalable platform that empowers CMS to deliver its commitment to high-quality data-driven healthcare reporting.
Why Redis and Elasticsearch? Redis, a set-based database solution, delivered exceptional speed for hierarchical queries. This enabled near-instant intentional value set operations. On the other hand, Elasticsearch brought powerful search capabilities, indexing millions of clinical codes across ICD-10, CPT, LOINC, and SNOMED CT. It functions like a search engine for value set authors, enabling intuitive full text and keyword exploration. Together, Redis and Elasticsearch reduced query times from few minutes to few seconds. This wasn't just a technical upgrade, but it was a strategic leap forward, transforming VSAC into a scalable, high-performance platform that supports CMS's national reporting objectives.
While performance optimization was a major milestone, it was only a part of the transformation. CMS's broader vision, semantic interoperability across multiple platforms, required VSAC to be more than fast. It needed to be universally accessible. To achieve this, Talteam embedded FHIR terminology services directly into VSAC, which enabled standardized APIs for value set validation, retrieval, and expansion. The strategic move eliminated the need for custom integrations. Now, tools like Maddie and Bonnie seamlessly connect to VSAC using the same FHIR APIs as external partners, creating a unified ecosystem for measure development and validation. And the final impact of all this solution is reduced manual processes, accelerated onboarding, and alignment with CMS's nationwide interoperability goals. VSAC has evolved from a static repository into a dynamic interoperable engine powering the next generation of quality reporting across the healthcare landscape.
Talteam consultants have enabled standard-driven eCQM authoring in Maddie by integrating VSAC and FHIR APIs, empowering measure developers with a collaborative, web-based platform that streamlines development and ensures consistency. Bonnie, another application in CMS, plays a critical role in validating measure logic. Talteam's enhancements in VSAC ensure that every published measure meets CMS's rigorous standards for accuracy and quality, reducing errors and increasing confidence in reporting. The results speak for themselves. Talteam's innovations in VSAC have improved consistency in quality reporting and have enhanced interoperability across NIH and CMS's tools and platforms.
N21.ai brings deep domain expertise in Medicare Advantage, clinical strategy, and AI innovation. Its flagship solution, Chiral, is a smart agent-human system designed to manage the complex, compliance-driven workflows of managed care with precision and scalability. Here's N21.ai to talk more about their solution.
Hi everyone, I'm Dr. Aparna Gadekar. I'm the Chief Clinical Strategy Officer with N21. N21 is focused on driving healthcare outcomes at the individual member level. N21 is a new generation healthcare AI company, fundamentally reimagining the healthcare industry by building a new operating system, Chiral, that leverages agentic AI. In our reimagined future state, we will have highly efficient AI solutions applicable to every step of members' lifecycle. Chiral will be providing a seamless, end-to-end intelligent business process for members, providers, and health plans. Members are the nucleus of our focus. We strive to create a sustainable AI ecosystem that strengthens our existing payer-provider infrastructure to significantly improve healthcare outcomes, quality of care, and affordability. Our proprietary Chiral solutions automate many involved complex MA operations, including prior authorizations, appeals, care coordination, transition of care, population health management, risk adjustment, etc. For example, for prior authorization in our current process, it can take anywhere from 10 to 14 days to process a prior auth request. This is after the team starts working on the case. A lot of times, the cases are sitting in the queue for days before they are touched. This results in poor patient experience as well as delay in care. Only around 11% of the denials are appealed, which means 90% of the times the services that were required by the members are either delayed or never provided. With our solution, prior authorization will be submitted in real time, processed real time, which will result in immediate determinations and prevent delay in care, improve patient satisfaction and provider experience. Similarly, today, complex care management is efficient and is not able to move the needle in terms of addressing patients' barriers and moving the needle in terms of improving healthcare outcomes. Chiral solution will be providing conversational AI to our providers, members, and payers, which will help with seamless transition of care, as well as help the member at each step of member's journey to improve the experience as well as outcomes. In conclusion, Chiral enables interoperability amongst all Medicare stakeholders using the latest of digital and AI technologies to meet the triple aim: affordability, quality, and experience.
At Talteam, we are excited about the potential impact our solution can bring to CMS programs. Thank you for your time and consideration. We look forward to the opportunity to support CMS's mission and explore next steps together.